Okay, so nice to see that we have some representation from the Swetland Center, from OSU, as well as from across our campus at CASE, as well as the food bank. So great, good morning, everybody. Okay. All right, so just to give a bit of introduction, and you can continue to let us know who you are and where you're coming from in the chat, but I just wanted to introduce myself and Dr. Rose. My name is Jennifer King, and I am the Assistant Director of Training and Community Education at the Swetland Center. I have experience in working on collaborative and multidisciplinary teams and large-scale project coordination, which allows for my support of several projects within the Swetland Center, including the Modeling the Future of Food in Your Neighborhood study, or FoodNest 2.0. And I also oversee the training of student opportunities or training opportunities within the center. I am joined today by Dr. Dominique Rose, who is the project manager of the FoodNest 2.0 study. With experience and interest in food access, health equity, and community-based food systems, she specifically assists in the coordination of group modeling building with the project's core modeling team. Today, we will present on our training related to participatory modeling and stakeholder engagement techniques and how they can be used to address complex problems. So Dr. Rose will now get us started with today's presentation.
Good morning, everyone. Thank you, Dr. King, for that introduction. I wanted to first make sure that we give special thanks to the University of Michigan, or Michigan State University, and Food Plus Detroit for hosting the Modeling Field School. Although it was hosted by Michigan State University, we were at Wayne State University. I also want to recognize that I was awarded a full tuition scholarship for the 2019 cohort. So the Participatory Modeling Field School featured 3 days of hands-on workshops on qualitative, semi-qualitative, and quantitative participatory modeling methods. Sessions were facilitated by faculty and community partners who are renowned in their fields and who are currently working on participatory modeling initiatives in Flint, Detroit, and other locations. Each day was a deeper dive into what the modeling process looked like. And today we will review a little bit of the participatory modeling methods as it relates to what was going on in Flint, Michigan, and what we are currently doing with the Modeling the Future of Food in Your Neighborhood study. Next slide. So what is participatory modeling? So before we get started, we thought it would be best to discuss what this was. Participatory modeling is a computational approach that brings together diverse perspectives on major health and environmental issues to solve complex problems. It is also a purposeful learning process for decision-making that engages the implicit and explicit knowledge of stakeholders to co-create formalized and shared representations. It is identifying and engaging the right stakeholders by discussing why. Why is this important? What are the roles or potential roles? And also by mapping engagement, which involves key activities or responsibilities and participation of each individuals who are interested in modeling a particular concern. It is also discussing agreements. How can we all work together? And what are the benefits of engaging as a stakeholder? Or how can we win or benefit from modeling all together? Next slide. So in the context of the Participatory Modeling Field School and the Field School, the main goal grounded itself in the Flint water crisis. And the goal of the project was to hear what the community understood the problem to be, what they believe caused it, and how they think it can be mitigated moving forward. Stephen Gray, who is an assistant professor at the MSU Department of Community Sustainability, and who is also one of the facilitators in the Participatory Modeling Field School, invited a group of residents and individuals out in the community to speak about their experiences with the Flint water crisis. More than 60 individuals participated in their sessions. They filled out surveys and collaboratively represented the complex dynamic of the issues, primarily identifying the causes of the water crisis, the consequences and potential solutions of the crisis. Excuse me. Next slide.
Okay. So the Flint water crisis certainly was not the result of a singular occurrence or action, but rather a series of things that were connected or interconnected in some way. So here are the telling signs that you're kind of working in a system and that we can observe when considering health inequities, which can also include food access. So problems are persistent and ongoing, despite having repeated interventions such as implemented policies or programs within the community. There is a pattern of behavior underlying an event. So again, things are just kind of ongoing, persistent, and kind of staying at the status quo and not really changing for the betterment of community members. We certainly do disagree with things, and sometimes we can do so passionately. And that can be about the root of the problem and how to solve the problem. So as we see in the image on the screen, above ground with our plants, we can see that there's an obvious problem. But getting into underground and into the roots, that's where we can really consider what are the true causes of this problem. And that's where opinions and passions may differ with those who are involved in the system. Lastly, within a system, there could quite possibly be an outcome that is the opposite of what the intervention, so what the policy or program intended to accomplish. And we can identify those as unintended consequences. We can also think about an archetype, which is fixes that fail. And in doing so, we would have an unintended consequence. So for the context of Flint, Michigan, we have a money-saving approach where water was switched from the Detroit River to the Flint River in April of 2014, and therefore causing lead issues within the city's piping, and that became particularly elevated and evident in 2016. We can also think about this in the context of Foodness 2.0, where even today, we can think about emergency food access with pantries or the food bank that are no longer used for emergencies, but have transitioned into an ongoing source of food for members within our community. But regardless of what is the context of a system, there are pretty typical habits of a system thinker. From this visual, we can see that there is interconnection or dependency of these thoughts and behavioral processes. Variety of opportunity to engage with stakeholders to cultivate vision of change within a system is really a goal within looking at the various aspects of what a systems thinker kind of envelops within their habits. So they try to see and understand the big picture of not only what is the problem, but what are potential solutions. They're able to change perspectives to increase their understanding. This certainly isn't overnight, and it certainly doesn't come from, again, one source of information or data. It definitely takes input from multiple people who are going to have an impact in changing that perspective. And then it's going to be a consideration of, again, those unintended consequences of actions, whether they are short-term, 1 to 3 years, or long-term, 4 to 7 years, and even 10 years out. From our training, we learned that through participatory modeling for stakeholder engagement, a systems approach can frame this work, whether again it's with the context of Flint, Michigan, or the context of Food Nest and our local food system. And we do this as an exercise in listening to identify the levers of change at multiple scales. So like most approaches, particularly in research, things are much easier said than done. And there are questions that we must ask ourselves and our co-investigators before jumping into participatory modeling. So first, we want to think about what's the purpose. Why is this approach of participatory modeling being selected? Why do we want to, get input from all of our stakeholders? This is really going to help us provide justification as to why this, particular model approach is being used. From there, we can begin to think about the processes or define the characteristics of the interaction between the participants or the stakeholders and the model. We're able to describe their level of participation by the various types of stakeholder, whether you are a resident, whether you are a retailer or organization, or whether you're within an overseeing organization. And then we can begin to understand the relationship between the participatory modeling and the decision-making process. Next, we want to understand more about this partnership of who's participating and why. What is their motive to participating, in the context of the issue that we have at hand. By defining data needed for the model and the process, we can begin to establish ownership by identifying the criteria for inclusion of participants and the steps each individual can be involved in. And lastly, what is this product? What is going to be produced by the modeling process? Is this a guide? Is this a toolkit? Is it something else? By defining the characteristics of the participatory modeling tool that's being produced, it allows us to acknowledge the social outcomes of the process and begin to actively engage with its policy, management, or scientific insight. Now, before we jump fully into participatory modeling, I want to take a little bit of a step back to consider all the tools for systems thinking. And kind of similar to the habits of a systems thinker, we kind of see that within each area or approach, there is some interdependency within each. So with the qualitative approach, we are going through problem identification through framing of the issue and analysis of cause and effect relationships. With the semi-qualitative approach, we're thinking about data collection about the problem through obtaining parameters and other important data or variables that can be used for computational approaches. And lastly, with a quantitative approach, we're thinking about really analyzing the problem by asking those questions that Dr. Rose presented earlier. What's unforeseen, what are the whys, and what are the what ifs about the system. Next, we will go over two approaches for system thinking. One is going to be a qualitative approach, and then second is going to be a semi-quantitative approach. So now I'll begin. So if you have participated in the Cleveland-Cuyahoga Food Policy Coalition Task Force activity from late 2019 into February of 2020, you've participated within this activity. And so this image may look familiar to you. This is the image of a timeline. And when used at the beginning of a project, timelines really help us to understand the change or the evolution of a system within a given period. It helps us to identify when a system was last in a desirable state. However, it's important to note and something that was really indicative of our training was that when we're thinking about desirable state, we're not necessarily talking about or using the timeline to indicate who it was most desirable for. So as we think about who are our stakeholders, again, our residents, our retailers, or our organizations or regulators, we really need to be considerate of what is a desirable state, how is that defined, and who is it most desirable for, or who was it last, most desirable for. Therefore, by engaging in what we had was a colorful coordinated activity with different stakeholder groups, we were able to create context of how an evolution of outcome may have impacted different groups. And within this particular activity, our stakeholders included members of the community. It included members of the higher education or university community, as well as college students and members of other nonprofit organizations within the greater Cleveland area. So the activity in itself sought to help us understand how policy change will disrupt the root cause of the inability to access fresh, healthy, and affordable food by contextualizing an issue within the idea of having limited household financial strength. Our stakeholders, who of course were of varying experience and expertise, used sticky notes to arrange a series of actions in the order each needed to occur to successfully implement a policy solution within a 10-year period. They also identified unintended consequences of the action and who might be a target audience for whom the policy solution in each step of implementation should be tailored. From this activity and from the training within the field school, we learned that timelines allow you to bound system within a temporal idea or a temporal context. You can think about, when do the events start that your interests are most related to? When did they stop? And what kind of steps need to be put into place to kind of get to the outcome that you're thinking about? It allows you to understand the influences on other parts of your research design within the system. And ultimately, it allows for the creation of a narrative of change when looking for trends or connections with additional longitudinal data that can be placed on these sticky notes and kind of put into the timeline and how the participants in this activity see fit.
So Jennifer mentioned that there were two different types. So this is a picture of a causal loop diagram, a COD or a COD. It aids in visualizing how different variables in a system are interrelated. So this causal loop diagram, which is a semi-qualitative approach of the Modeling the Future of Food in Your Neighborhood study, it's depicting two of our four tipping points. Two of our four tipping points, which are household demand for fresh and healthy foods or neighborhood access to fresh and healthy foods, are two factors or tipping points that create small changes that can become significant enough for a larger impact within the food system. So the Modeling the Future of Food in Your Neighborhood study, the end goal is to develop credible and relevant computational tools to offer a systems lens within an equity framework to guide future sustainable local food systems change. So overall, we would like to build a model that could be translated into a decision support tool that would offer the best intervention for the community or neighborhoods. Next slide. So this current slide presents the phases of the modeling process. Although an iterative one, Currently, the Modeling the Future Foodness is in phase 3 of the project. So phase 1 or year 1 allowed the research team and community stakeholders to build conceptual models and share with the community our 4 targeted neighborhoods with a public convening. So the public convening allowed us to share what we've done with the community and allow for feedback. In phase 2 or year 2, the research team translated the qualitative conceptual models into quantitative stock and flow models to simulate current relationships or to investigate if they predict existing trends. And currently we're in phase 3 or year 3 of our project, where we hope to translate and share our current simulations to each of our targeted neighborhoods to see which scenario they're interested in modeling. Next slide.
I'm sorry, I was talking to you guys, but I was definitely still muted. So within the time that we attended the field modeling school and being able to apply that training to the Foodness 2.0 study, we really learned that there is power in participatory modeling, particularly the visualization tools that we use today, or that we reviewed today, excuse me, and that we have used to kind of start out simply with using the timeline to create the visual context of the issue that we're looking at, being able to kind of move around those sticky notes based on the input and the experiences of the community members or research team members that we had in attendance, and really be able to take in what is the big picture of looking at 10 years out from today, how these things are going to be impacting the household financial strength. And of course, we did that activity in February of this year. So we know looking at today, we need a lot more sticky notes and quite possibly a few other color sticky notes to really be able to put into context what is the financial strength of households today and how can we implement policies or programs to be able to ensure that these households, wherever they are able to access fresh, healthy, and affordable food. So by engaging in the participatory modeling process, it facilitates an understanding of the system elements and how they all interact with each other. Again, especially as we consider the various stakeholders that we can involve in the process. And that's a bit telling of the image that we have on the right-hand side of the screen. There's a lot going on here, but everyone is interconnected in some sort of way as a resident, a community member, a retailer or provider, or a regulator or organization. Participatory modeling fosters stakeholder engagement through the conversations that occur when using them, or occur when creating and using them. And that is indicative of what we have been able to experience specifically with the Foodness 2.0 study and the core modeling team, which is comprised of community members, organizations, as well as nonprofit representatives who are able to provide their input based on their experience, their expertise, and the lives that they're able to live within their respective areas, whether it is work related or whether it is their home. In doing so, we're able to capture the greatest asset, which is the stakeholder voice, especially for residents who may unfortunately feel as though that they have the least amount of power to affect change, and that either government institutions or higher ed institutions don't have their best interests in mind. Because of historical mistrust community members may anticipate that recovery efforts might be complicated or might have potential solutions that cause more harm and conflict than good. So going back to our unintended consequences. But by engaging in participatory modeling, we're again helping to create a product with the community and wanting to develop a sense of empowerment within the community that their groups or individual residents could use in reference when discussing policies or following through with other realistic actions that can be used to address their concerns.
So Jennifer is going to put the link to a document that we came up with, which are good resources that the Participatory Modeling Field School have provided for us. The first of which is the link for the Modeling the Future Food in Your Neighborhood study, to just give you a little about what we're doing, who we are, who our stakeholders are, and what's to come. The next link would include the Participatory Modeling Field School. So a little bit of background about the 3-day process, what's included in that, some of the facilitators, some of the work of the facilitators and the work of the Flint, Michigan Crisis. In addition to that, Food Plus Detroit, which is a nonprofit who works with Michigan State University, some background on them and their website. Thinking in Systems, Meadows, which is a good article to start you off with thinking, with systems thinking, excuse me. Next is the Flint water crisis. So hearing the community's concerns, something that I mentioned previously, hearing the community's concerns, what they said, what they mentioned about the water crisis and what their preferred state looks like. Next is What the Eyes Don't See, a story of crisis, resistance, and hope in an American city, by Dr. Mona Hanna. She actually was at the Let's Safe Home Summit in Cleveland, Ohio last year, and I'm not sure if everyone got the book, but there's a link to her book and how the crisis began, and what she foresees is a good Next is the, oh, my internet is unstable. Sorry. Lastly is the Translating Community Narratives into Semi-Qualitative Models to Understand the Dynamics of Social Environmental Crises. This is an article that some of the facilitators have suggested that we looked at and read, and some of the sources they've linked in their slides. So now we wanted to definitely open the remaining time for questions about not only the Participatory Modeling Field School, but any of the information that we've presented.
And just really quick, unfortunately, I'm not able to post the list in our chat box as we anticipated, but I will post the list to the Swetland Center website so that you all will be able to take a look at everything that we've been able to mention today, particularly the information about our FoodNets 2.0 study, as well as the Flint water crisis, and being able to kind of think about what the community's concerns are and really listening, or excuse me, reading the story of Dr. Mona, who really brought to light this issue and putting her profession at risk and being able to do so. So really being a part of what that essential asset is in this research, which is using her voice. So Dominique and I were really excited to share this information with you all, and we got done a little earlier than anticipated. But I think that it's really important to, again, as I mentioned, allow for you all to ask us questions and you know, be able to think about how we can apply the participatory modeling process to today's event and how that is going to change a lot for the research that we're doing, whether it is environmental health, food systems. I know that there are different attendees here, so really thinking about how we might be able to apply it to our COVID-19 world. So if there is a question that you would like to pose to us, or that you would like to kind of provide comment about, if you can use the raise your hand feature or the Q&A feature, and then I can unmute you so that everyone can hear what you're saying.
We actually have a question in the Q&A box by Miss Lakita Worley-Bell. She mentioned, is there a way to get these handouts look like we can combine into a book? I do believe that you will post the handout or the PowerPoint on the Swetland Center website, but I can personally send you both and the links to all of the resources that we just mentioned.
So I guess I'd like to pose a question for Dr. Rose, and just asking about your reaction to the training, and as project manager, because you spent a bit more time on the project than I have. What is your reaction to the training, and how do you see the idea of using the different approaches with what we're dealing with today, going forward with the FoodNest 2.0 project?
Absolutely. So I actually started the FoodNest 2.0 project right in the middle of, well, actually right after I defended my dissertation, and it was the summer of 2018. And when I started, I had no idea what modeling was and or this type of research was. And once the training came across my email, I was like, okay, this is something that I need, given that I have so many things on my plate. One, dissertation; two, managing the project; and three, just getting back acclimated to being in Cleveland, Ohio. Because once I left for school, I didn't have that many resources, given that everything changed in the span of the 4 years. So the modeling, the participatory modeling field school allowed me to take a deeper dive into what modeling and systems thinking was about. And I think that it offered overall a very good very detailed background about the different types of approaches that we can use in the entire modeling process. Each of the resources that we've mentioned, I've read. So Dr. Mona's book was a really good, important book to discuss, unfortunately, the issues that was happening in Detroit. So I'm glad that I did read that. And then even Meadows allowed me to not only see problems in a different way, but also kind of focus on the community's perspective. My background isn't particularly participatory, engaged research with the community, so it allowed me to think in a different manner. So as your question is framed, how do I feel? I think you mentioned how do I feel that this would work in the current pandemic today? I think that most importantly, hearing what residents of the communities feel is most important and what their preferred state would look like, I think would be the initial, in my mind, the initial thing that we focus on, given that although this pandemic is affecting everyone and the different groups of individuals, but I do think that the individuals who are most vulnerable should definitely have their voices heard first and foremost. Did I answer your question?
No, you did. Sorry that I was not muted and that I'm like typing away in your ear and in everyone else's ear. We do have some good questions coming in, but I do thank you for responding to that and just wanting to get your take on what the field school kind of meant to you and how it was able to kind of provide greater context to the project. I would definitely echo what you said in that I started on the project in July of 2019 and we attended this training in August of 2019. So it was really helpful for me to understand, what is participatory modeling and how does it kind of fit into the context of FoodNet 2.0 and kind of the insane and sometimes overwhelming CODs that we have, but also very relevant and important CODs that we have. So that was the image that that Dominique showed, that we were looking at the tipping point of, where or kind of the input that was provided and kind of the data and variables provided for the project, kind of being able to use that information. So I'm gonna kind of mention some of the questions that we have in our Q&A as well as from our chat box. I'm not sure who TW is, but their question is, how do you think participatory modeling can be utilized when involving young people in research? So using youth members as co-researchers.
Mm-hmm.
So I will, I guess I can respond to that. Although my personal research has not necessarily involved younger researchers, but it's certainly important to really consider the voices of our future generations as we think about what are the practices or actions that we want to put in place, especially when we're thinking long term over the next 10 years. I think that by utilizing quite possibly the timeline, I always go back to the timeline, not only because of the ease of use that it has, but also that it's kind of inviting to the eye and that you can kind of create whatever you want with the timeline in using materials for it. You can make it colorful, you can make it inviting and engaging to do, and it also allows everyone to write their responses or write their questions in their own handwriting so that they feel that they are physically involved in the activity and that whatever it is that they feel or that they mean and what they say is not being interpreted, not in a malicious way of misinterpretation, but just making sure that they are feeling heard. And I believe that quite possibly having the younger researchers, do their own timelines and kind of then coming together to see how those timelines look different, because we certainly aren't all living in one particular bubble. So our experiences are all different, even if we're one street apart from each other. So I definitely think that by using participatory modeling with our younger researchers and kind of get them into the idea of seeing the bigger picture, seeing what are the unintended consequences of what one action, may hold for the future. I think that's really important. And again, I always say that the resident voice or the stakeholder voice, and certainly the voice of the youth, is a very big asset to research and planning and policy implementation. So thank you so much for that question. We do have another question asking Also, and this is from the same person, Dominique. What are the most central or important questions to ask community members when attempting to gauge the community needs and intervention support?
I couldn't hear you.
I'm sorry. It what are the most central or important questions to ask community members when attempting to gauge the community needs and intervention support? And what models or systems approaches have we been using to ensure the sustainability of our
Absolutely. So currently we've been using the causal loop diagrams to kind of depict what the food system looks like in Cleveland, Ohio. Some important questions that we always like to ask, is what is the preferred state of the food system, or even the community in general, that the individuals would like the system to be at, for example. So what does emergency food assistance look like? How does that play a role in the food system as a whole? Another question would be, let's see, what is a potential solution? How can we alleviate the use or the overuse of emergency food assistance? Or currently, given the pandemic, a lot of individuals do not have access to emergency food assistance. So how can we either, what is our priority? Is a priority getting emergency food assistance to individuals in the community who don't have transportation, or is priority shifting that mind frame of utilizing emergency food assistance? So there's not one question. It's how we frame the question and to whom the question is framed for is a better, I guess, answer to your question. So I don't think that there's either a right or wrong question to ask, but I do think that being authentic and transparent in the questions that you're asking community members is the most important.
Sorry, I keep forgetting to unmute myself. We do have another question, and it's kind of a comment and a question at the same time. So thank you, Tim, for this. So while we typically think of the public health community in a positive light, in Flint, some of the public health authorities were a huge part of the problem. And this could perhaps be due to very strong political pressure. He wants to know if we have any ideas for dealing with this type of pressure when you are trying to have inclusive big tent conversations.
I can take a stab, and if you want to chime in as well. So Food Nest has a big group of stakeholders, diverse stakeholders, and they hold very many positions. They work at many different entities, and I think one of the most important things that we could have done with Food Nest is develop principles of partnership. So principles of partnership for the core modeling team is 12 values that we kind of hold for the group when asking these really difficult questions or trying to build models or even build scenarios. So I think most importantly, out of the 12 principles of partnership is balancing power among partners and enabling resources among partners to be shared. Now, because individuals hold many different hats and many different positions, I think that's probably the most important factor that contributes to not only discussion amongst the group, but also trying to identify different solutions or scenarios when, power is an issue. So for example, if we have individuals who work at a big corporation or institution and individuals who are from the community, I think it's really important that power is shared and that we recognize that individuals hold these different positions, but we won't let power be amongst one of the many issues that we face to hold us back against having these difficult conversations. And the more and more we think about different solutions for the community and how we can ignite change or change the system or what we can do to tip the system, I think it's important to note that change is hard for everyone. And most individuals don't necessarily agree with the changes that we as a group or some individuals present, but having open communication and sharing specific ideas and agreeing on specific goals or measurable outcomes, I think is going to be the most important when we're talking about issues as big as a pandemic or as big as the Flint water crisis.
Okay, thank you. I'm looking at our participant list, and some names are highlighted in orange, and I am honestly not sure why. I can't tell if you all have raised your hand, and it doesn't give me an indicator that you have or haven't, but I want to make sure that I'm getting to everyone. So I'm going to pick on one person just to see if this is, if this is what I think it is or just want to confirm. So Gwen, I'm going to unmute you just for a second, just to make sure if you have or haven't raised your hand. Gwen,
Hello, can you hear me?
Yes.
Yeah. Did you raise your hand?
No.
Oh.
Okay, no, it's not for me. I just wanted to make sure. Okay, I'm going to go back and mute you.
Okay.
All right. And I do want to make sure that I acknowledge David Lounsbury, who is one of the co-investigators on the FoodNest 2.0 project, who thank you so much for giving kudos to Dominique and myself for the presentation. I'm going to go ahead and proceed just because I want to be mindful of everyone's time. But if you all do have questions for Dominique or myself about, again, the context of this work and the context of this work in regards to how we were able to engage with the training, but also how we are able to integrate the training into the FoodNest 2.0 project, please feel free to reach out to us. And again, I will, or Dominique, or I will send out that resource sheet to everyone. So given our new delivery of our seminars, everything is going to be via Zoom. So today, first, and we're really kind of testing the water. So I appreciate everyone being patient with us and asking your questions. They were really helpful. And this was actually a really fun experience that I was super nervous about an hour ago. So next in queue, what we have is actually a COVID-19 related seminar that we're doing in partnership with the Cleveland Cuyahoga Food Policy Coalition. And it's really going to look at food policies and have key players within the food system of Greater Cleveland during its convening. So you can find that information as well as information for the other seminars that we have coming up on the Swetland website. And at the end of this webinar, please do not close your browser because you will receive a link to a survey allowing you to sign up for the Swetland Scoop, which is going to be another way that you can find out about upcoming events or any upcoming news that we have coming out of the Swetland Center. So I'm excited to not only attend the upcoming seminars, but allowing you all to really see the talent and skill and expertise that we have within the Swetland Center, including our staff members and one of our postdoctoral scholars. So with that, I hope that you all have an amazing Tuesday. I have to remember that it's not Monday. An amazing Tuesday. And again, thank you all for attending today's seminar. I will be sure to send out invites for all of our upcoming seminars.